How's it going, guys? So a medium difficulty question for pharmacology for step one. I will keep this very clean and concise, tell you exactly what you need to know, not waste your fucking time. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. The link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the question. 29-year-old man admitted to the hospital, 4-day history of fever and fatigue, temperature 103 Fahrenheit. He has a 3-on-6 holosystolic murmur auscultated at the apex. You need to know that new onset murmur plus fever is endocarditis until proven otherwise. Very high yield. Blood cultures are drawn. Patient is initiated on empiric antibiotic therapy that includes a protein synthesis inhibitor. You need to know that the standard empiric therapy for endocarditis is going to be vancomycin plus gentamicin. Yes, there are other regimens that could be used, but that's the standard high yield one for USMLE. Vancomycin targets gram positives, including MRSA. Gentamicin targets gram negatives. Gentamicin is an aminoglycoside, which is a 30S ribosomal subunit inhibitor, which is a protein synthesis inhibitor. And the question is asking which of the following is an adverse effect that must be considered when commencing gentamicin. So let's just walk through the answers here. Choice A, bone marrow suppression, wrong fucking answer. This is a very generic, non-specific answer. Could apply to many immunosuppressants such as azathioprine, cyclophosphamide, etc. Methotrexate, vinblastine, non-specific, wrong answer. Choice B, crystal nephropathy, wrong fucking answer. This is acyclovir. It's a sort of a very factoidy detail some students get really excited about. Extremely low yield, but acyclovir can cause kidney stones, okay? Choice C, dilated cardiomyopathy, wrong answer, but you do need to know that adriamycin, aka doxorubicin, which is a chemotherapeutic agent, can cause dilated cardiomyopathy with systolic dysfunction, okay? Very important, that detail. Choice D, fibrosis of the alveoli, pulmonary fibrosis, wrong answer, but you need to know methotrexate can cause pulmonary fibrosis, as well as amiodarone, busulfan, bleomycin. I would say the most important ones for pulmonary fibrosis, methotrexate number 1, bleomycin number 2, amiodarone number 3, busulfan number 4, okay, causing pulmonary fibrosis. Which would be a reticulonodular pattern on a chest x-ray, whereas dilated cardiomyopathy leading to pulmonary edema would be a bat wing appearance, just general infiltrates on chest x-ray. Choice E, restrictive cardiomyopathy, wrong answer. Just general distractor here, okay? There's no specific drug you need to know that causes restrictive cardiomyopathy for USMLE. Trastuzumab is cardiotoxic, not specifically restrictive. As I said, adriamycin, doxorubicin is dilated cardiomyopathy. And then our correct answer is vertigo. Now, this is where the questions, it's like, ooh, wow, slightly difficult, because aminoglycosides, such as gentamicin, can cause ototoxicity and nephrotoxicity. The ototoxicity need not be neurosensory hearing loss or tinnitus. It can be the patient feels the room is spinning. It can be vertigo, okay? OMG, holy shit. So vertigo, tinnitus, neurosensory hearing loss for ototoxicity due to gentamicin, and you can also get acute tubular necrosis, super fucking high yield, okay? Because many drugs can cause different renal pathologies, but aminoglycosides in particular, acute tubular necrosis. If they want tubulointerstitial nephropathy, that's going to be beta-lactams, cephalosporins, NSAIDs. If they want membranous glomerulonephritis, that can be dapsone, sulfa drugs, and gold salts, okay? But aminoglycosides, acute tubular necrosis for the nephrotoxicity, and then the ototoxicity, neurosensory hearing loss, tinnitus, vertigo, the room is spinning. You know the deal. I'm going to continue making more content. If you like my stuff, subscribe to my channel, and I appreciate your time. That's it.